For more than 3,000 people in Hertfordshire, home is a care home. There are even more elderly people living in their own homes who need extra help as they become increasingly frail. Hertfordshire County Council, the Hertfordshire Care Providers Association and East and North Hertfordshire Clinical Commissioning Group have all been working together on the Care Homes Vanguard programme, targeted at keeping frail elderly care home residents safely and healthily at home. We introduced additional training for care home staff, support at home from early intervention teams, a hospital worker liaising with care homes over patient discharges, and support for homes around end of life. This film is just a snapshot of the wonderful work our Vanguard partners have been doing, and a thank you to everyone involved.
I had a particular thought team turned up, checked me over, and the occupational therapist that was on board with them as well checked me as well, looked around and suggested various pieces of equipment. First of all, grab rails for my bed, and also equipment for the kitchen, chairs. And they actually went out to the van and got these things and brought them in and installed them. And it's been the best thing that's ever happened.
By keeping people who are medically well out of hospital, we're helping them to maintain their independence on a much greater scale. Right, Roy. Merry Christmas.
Yeah, I'll see it.
So these are to help raise your chair up a bit.
Okay. Yes, they do a good job, there's no doubt about it.
What we've had to do is we've had to engage the managers as well, so it's about leadership. Those managers have had to understand that what they are doing is they're upskilling certain members of staff. Those members of staff will be able to cascade that information through the rest of the staff teams.
Completing a dementia champion training, I was able to support our residents in their mobility who had very contracted limbs. I was able to set up a 24-hour postural management for them. Our champions are trained nurses as well.
The impact on a patient's relatives and residents is that they are the centre of the care. Opens up the conversation about the meeting their wishes, choices and preferences and avoiding unnecessary hospital admissions. The impact on a care homes is actually the staff feels more confident as a result of having a training on end-of-life care palliative. Improves their confidence and the quality of care within the home itself is improved. Not only that, the staff feel more confident in dealing and talking to other professionals.
There you go, ladies.
When we've used the assessors, basically the process is much quicker getting them back home from hospital. Obviously our residents are going to benefit from having an assessment in the hospital rather than waiting for us to come out and assess them.
I think the service has had a very positive impact on the relatives and the patients. They feel that they're being listened to. We can take on board criticism and pass it on to either the care home or the hospital.
It frees up our time, obviously, to spend with the residents that are in the home. Family are getting reassurance as well. Everything's a smooth process. It happens really quickly as well. So yeah, I mean, it's much easier for families and the residents.
Hello Lillian. Hello. How are you, my love? All right?
It's been a fantastic project. I think it's improved working relationships. It was very much a shared learning for all of us that were involved, and ultimately the residents were the end result of that and the medication that they were receiving.
We're ideally placed as the medicines experts to be involved in this, and there's been a lot of shared decision making when we have our weekly meetings for the medication round, because we've been able to have lots of sources of information, i.e. from care home staff, the GP, pharmacy. We've been able to make best decision for the residents.
We have integrated lots of new things with the home itself, but also with my surgery, making sure that processes are in place where repeat prescribing and things can be done in a more smooth manner. We have reduced medication burdens for a number of patients. One particular patient was thrilled that we reduced her medication burden from 10 medications a day to 2. She thinks it's the best thing ever.
The Vanguard project's had a really successful impact on our patients and residents and avoiding unnecessary hospital admissions. The impact that it's had on hospitals, A&E departments, the emergency services as a whole and social services for discharge planning, I think it's been really positive.
We've had some great clinical outcomes, so a lot of patient satisfaction, a lot of staff satisfaction.
I think the Vanguard project has had a very successful impact on the relatives and patients. It encouraged improvement within the hospital. I mean, today I've received 6 referrals. Realistically, we hope to get them back to a care home within the next couple of days.
The Vanguard project has had a successful impact on a resident because it's allowed them to express their own wishes, desires and their own preferences and choices.
And also everyone working together in the new models of care, the new way of working, it's worked out really well.